members of the Armed Forces, San Diego Fire Department, San Diego Police Department, and other sufferers of PTSD. We would like to welcome you to the Yeager Group presentation on surviving the effects of PTSD in everyday life. Today, we will raise awareness to the individuals suffering from PTSD by discussing 5 new and promising treatments of PTSD. These topics tonight will include the use of virtual equipment, the 2-stage process of fast-acting propranolol, the psychiatric and physical effects of using service dogs, the use of horses to regain trust to the PTSD sufferer's life, and we will finish off with the use of neurofeedback. The first treatment available to PTSD sufferers that we're going to talk about tonight is going to be the use of the virtual reality helmet. This virtual reality helmet, according to Rachel Young, will give PTSD sufferers a real-life scenario. They will have a 360-degree view of the scenario which caused them to have PTSD. The scenario can be altered to give them the exact situation that they were in. They'll have a video game style control which they will be able to navigate through the scenario to create the exact scenario which they were in. They will have speakers which will give them the sounds, and soon they will have a way to have the scents in the scenario also. So if there was a certain scent that would trigger something in the scenario, they would be able to experience that also. The idea behind this virtual reality helmet is to slowly and progressively habituate the PTSD sufferer until the fear and the PTSD is eventually gone.
There is a new and exciting drug on the market called propranolol. It is believed that the beta blocker propranolol can interrupt the reconsolidation of traumatic injuries. This is through the inhibition of protein synthesis. Studies show that a 40 milligram fast-acting dose administered after a memory recall with an additional 60 milligram extended-release dose administered 2 hours later seemed to fragment the memory. It was initially described as an induced partial amnesia. In recent studies, however, it has been said that the drug reduces the emotional aspect of the memory without affecting the memory itself, making it less emotionally stressful. During one of the studies, 9 people were given the treatment and 10 people were given a placebo. 2 weeks later, there were significant results in the 9 that were given the treatment. Even though this drug sounds very promising, the results are not as significant in people who have experienced severe injury or loss of limbs. This was discovered during another test where 31 patients were given the fast-acting dose followed by the extended-release dose. Out of the 31 that were given the drug, 28 responded with an improvement score of 8.8 out of 10. Of the remaining 3, 2 had amputations, and 1 had previously been on a beta blocker medication for a cardiac indication. As you can see, propranolol is an effective drug that can be used in a large number of PTSD patients.
Use of service dogs to aid the PTSD sufferer greatly enhances physical activity to the sufferer and gives the patient a secure sense of independence. A well-trained service dog can assist a PTSD patient with mental stressors, and helps the PTSD person's daily routine, schedule, and overall accompany the PTSD affected person with the assurance he or she has a trustworthy companion. The service dog is around the PTSD patient 24 hours a day. This canine contact brings a very close companionship between a PTSD sufferer and the canine. Canine cues the patient for specific tasks, such as taking medications, when to turn the lights on and off, as Dr. Veronica Morris has researched. The patient has also become more active by having to take the canine on walks, which also results in the exercise of the PTSD patient and the canine.
The use of service dogs is obviously a really great way to help treat your PTSD, but service dogs are not the only animals out there who are helping PTSD victims. The Florida Multipurpose Center has been using horse therapy to help treat their PTSD victims. They have seen such great progress in so many areas, to include confidence enhancement, the increase of self-efficiency, which is important for PTSD victims. They've also seen improvement in the ability to trust again. Trust is a very complicated thing for PTSD victims, since most PTSD victims have lost their trust and their ability to trust because of some experience in their past. The Florida MPC has also seen progress in anxiety reduction, self-acceptance, social skills, assertiveness, and many other areas that most PTSD victims have complications with. Such a large animal helps build up people's confidence and their trust because of their ability to cause a calming effect on the person and the individual that is riding them. The experience with horse therapy has helped so many people suffering from PTSD. And who knows, it may be the right treatment for you.
Neurofeedback has been in research for over 30 years. Only recently has it been applied to PTSD. There is no medication required, and the treatments can be found with little or no cost to veterans. Neurofeedback focuses on your brain's ability to learn and adapt. Your brainwave activity is sent through an amplifier, and then a computer that analyzes the data is sent back to colors and patterns on the TV screen and through audio and headphones. When the brainwave activity becomes too intense, the screen will become more bright and colorful, and the patterns will move faster, and your audio becomes static or even louder. This acts like a rumble strip for your brain and self-corrects. For example, a veteran from the Vietnam War who's been suffering from PTSD for over 40 years, his symptoms were cut down by 50% after only 3 treatments of neurofeedback. After 18 sessions, his symptoms of irritability, unrestfulness, anger, depression were all down and under control. You can find more information about neurofeedback at homecomingforveterans.org and about neurofeedback.com. Currently, there is no cure for PTSD. We can only manage the symptoms. The purpose of this presentation was to inform sufferers from PTSD and their family members about 5 treatments available, whether it's virtual equipment, medication, service dogs, horse therapy, or neurofeedback. It's important to remember that there is many options available and to never give up hope.